We want to talk this morning about a basic need that many families simply can't afford, and it's just health care. Health care for physical and mental health. But as Joe Ripley is here joining us now to tell us, there is a local organization out there making sure folks are not forgotten in this regard.
That's right, Dan. There simply just aren't enough healthcare providers when you really think about it to serve all of our healthcare needs, especially bringing that affordable element to all of this. But the Urban Clinic, which is actually celebrating its 10-year anniversary of opening up this year, 2016 is when they first opened, they are now helping to fill that gap for low-income families seeking critical mental health care and physical health care as well. When emergency rooms are full and there's nowhere else to go, patients turn to the Urban Clinic of Atlanta.
We are a free clinic for people who are uninsured and low income, so all of our patients are totally uninsured and 200% are below the poverty level.
Executive Director Susan Watley says the clinic sees around 900 patients across 2 locations. She says most are working but don't get health care benefits, only work part-time, or they're in between jobs.
So a lot of patients just fall in this gap. They don't qualify for Medicaid, but they don't make enough money to be able to afford insurance.
The Urban Clinic offers free primary care services, imaging, referrals, transportation, medication, and mental health care.
Treating depression, hypertension, high cholesterol, but then we started realizing how much all these things affect that. So mental health affects that.
The Atlanta Women's Foundation recently released a study showing provider shortages, insurance limitations, and transportation barriers were all behind more than half of delays or cancellations for mental health appointments.
Before a woman can get onto a path of economic self-sufficiency, she's got to become healthier.
Atlanta Women's Foundation President and CEO Kari B. Love says women impacted by poverty are twice as likely to have an issue with struggles like depression, anxiety, or substance abuse.
Our patients are working, but they just have so much stress, and then which causes mental health issues. And a lot of these are because of job insecurity, the stress of raising kids, sometimes with help, sometimes without help.
Susan Watley plans to form part of the solution to help get families' mental health care back on track. And the Urban Clinic of Atlanta is in line to receive a grant from the Atlanta Women's Foundation, and they're planning to use that money, Dan, to hire a counselor to further address mental health needs.
I mean, it just sounds like such a vicious cycle when you're in poverty, and then it leads to maybe addiction issues or mental health issues, and it sounds like they're kind of intercepting it when they can.
A lot of times, we tend to rush and, treat the symptom, right, when there may be a deeper rooted issue. And so I think it's clinics like these, the Urban Clinic, it's other nonprofits and service providers really meeting people where they are, understanding, they do have other things going on in life, but to move forward, to make progress, you really need to address that deeper seated issue. The numbers from this study, too, Dan, are staggering. Just for example, the ones that stood out to me, this study finding local nonprofit providers were seeing anxiety in over 90% of their patients, depression in more than 80%, trauma in more than 75%, and then suicide or self-harm risk in nearly 40% of people. I mean, this is staggering.
Yeah, it is. It is.
And it is one thing to highlight the need, right? But you've got folks like we highlighted yesterday at Our House helping with the homelessness aspect. You've got folks like the Urban Clinic of Atlanta here today helping, and there are so many other nonprofits and organizations in our area doing what they need to do to help address that need.
The Urban Clinic, and they have a couple locations.
They do, yeah. They have one in Atlanta off of Cleveland Avenue on the south side. They also have the Good Shepherd Clinic down in Morrow, Georgia, in Clayton County. 900 patients they see, with probably around 6 or so staff members and volunteers. Wow. I mean, they are doing great work with limited resources, but you can see the clientele is there. They keep coming back because a lot of times they're stressing out these emergency rooms, relying on them for help, and then that is only driving up wait times there. It's making it harder for folks, maybe a little discouraging to go get seen about their primary care needs, but they are never running out of work anytime soon.
Those clinicians probably don't hear it enough. Thank you.
Thank you.
For what you were doing. Joe, thank you.